There's been an unbelievable amount of venture capital investment flowing into health tech companies. What started out as a lot of direct-to-consumer companies is now really shifting into the back end. And so why is this? It's because the infrastructure, this sort of piping, dealing with these administrative problems that aren't the sexiest, but they're really important to other businesses. Wheel is a digital health company that has two components. So the first is a staffing component, and the second is back-end technology for other companies to be able to stand up their own telemedicine practices. Digital health companies need to be able to have doctors, nurses, other providers who are licensed across all different states. Think of it kind of like a gig economy solution. Like if you use Uber and you call a driver and then the driver's going to be there soon, Wheel is doing a similar thing, but saying, I'm a patient, I need to talk to a doctor. I'll match you with the particular type of doctor or nurse or whoever it is that you need for your particular problem. On the back end side, they have something that's called white labeled, which means it doesn't say that Wheel is doing it, but a company could start offering telemedicine services by using Wheel's technology. The founder of Wheel is CEO Davey. And so first off, there aren't many women founders and CEOs in health tech. So the unique thing about Michelle is she founded this company that's really for the back end. It's enterprise. It's serving other digital health companies, and that's something that makes her stand out.
I actually started my career in healthcare due to my past. So I grew up in a rural part of Texas and unfortunately went undiagnosed with an autoimmune condition for over 15 years. And so for me, access to care has played a really large part of my life. When I first started my career, I went into healthcare to change it. And quite frankly, I became a part of the really big system that healthcare is, working for really large companies, and quickly realized that I was looking for something a little bit more fast-paced than the antiquated healthcare system that I was in at the time. Telehealth was where my personal life of rural community living and access to care collided with the professional background I had built in recruiting and operations. When trying to build in healthcare, everybody was building the software in these fragmented worlds, but really nobody was thinking about the clinician and the supply part of this that were actually the backbone of delivering this care altogether. So building in healthcare pre-pandemic in Austin was probably not obvious to many. In fact, a lot of Silicon Valley people had told me eventually I'd have to move my startup there to really grow it and scale it over time. I think the pandemic really blew the walls off of where we could build in healthcare and why these tech hubs are actually good places to build. There was a lot of great talent, maybe not in healthcare, but they were coming from other applicable industries that were scaling and growing, everything from fintech to retail tech, all across the board. And so for me, it was very important not only to build Wheel here in Austin as a healthcare company because of my personal background and access here in Texas, but because of the local talent. We were building Wheel in 2018, before it was obvious that a supply and demand imbalance were coming to virtual care. But to me, it was obvious that it was already happening in in-person care. It was really hard to access doctors wherever you were at. Oftentimes patients were waiting 2 to 3 weeks, sometimes months at a time, to access doctors in person. We didn't know a global pandemic was gonna hit only 2 years later, but when it did, the reality of the supply-demand imbalance, patients seeking high-quality care from the comfort of their home or wherever they were at, and clinicians working in a whole new way, really solidified almost overnight. Access to care is something obviously near and dear to my heart. And so our clients across the board look very different. I think what's really interesting is most of our customers have been delivering virtual healthcare for less than 2 years. So this is a very new industry, a very new service in the market. And quite frankly, we all had to convince a lot of people that this was the new way to build in healthcare.
Wheel has raised $66 million, and in 2020, the company's estimated revenue was $8 million. Now, Wheel is expecting really significant growth. They expect to be the back end for 1 million patient visits, and that's 5 times the number in 2020. There's really a lot of opportunity for companies like Wheel because we're gonna see just explosive growth in this back end software space because that's really the direction that the industry is headed.